Welcome. Today we're diving deep into a serious and potentially life-threatening condition, renal rupture. Also known as kidney rupture, this occurs when the kidney's structural integrity is compromised, leading to a tear or break in the organ itself. Understanding the causes, symptoms, and treatment options for renal rupture is crucial for both medical professionals and anyone interested in learning more about renal health. So, what exactly causes a kidney to rupture? The primary culprit is blunt abdominal trauma. This can result from car accidents, falls from significant heights, direct blows during contact sports, or even acts of violence. Penetrating trauma, such as gunshot or stab wounds, can also directly injure and rupture the kidney. Less commonly, underlying kidney diseases like tumors or hydronephrosis can weaken the kidney structure, making it more susceptible to rupture, even from seemingly minor impacts. Occasionally, certain medical procedures like kidney biopsies can lead to a rupture, although this is a rare complication. To understand renal rupture, we need to look at its pathophysiology. When the kidney ruptures, blood and urine leak into the surrounding retroperitoneal space, the area behind the abdominal lining. This leakage causes several problems. Firstly, blood loss can lead to hypotension, or low blood pressure, and even hypovolemic shock, a life-threatening condition caused by severe blood loss. Secondly, urine accumulation can irritate the surrounding tissues, leading to inflammation and pain. Depending on the severity of the rupture, nearby organs like the spleen, liver, or intestines may also be damaged. The body's inflammatory response to the rupture further contributes to the overall severity of the condition. Renal rupture isn't an everyday occurrence, but it's not exceedingly rare either, especially in urban settings. Due to the prevalence of motor vehicle accidents and trauma-related injuries, young adults and males are disproportionately affected. How anyone, regardless of age or gender, can experience a renal rupture if they sustain significant abdominal trauma. Individuals with pre-existing kidney conditions that weaken the organ are at a higher risk, even from relatively minor impacts. It is also important to note that in pediatric populations, even seemingly minor falls may lead to renal rupture due to the relative prominence and lesser protection of the kidneys. The signs and symptoms of a renal rupture can vary depending on the severity of the injury. The most common symptom is severe flank pain. That's pain in the side of your back, often radiating towards the abdomen. Blood in the urine, or hematuria, is another telltale sign. Patients may also experience tenderness to the touch in the abdomen or flank area, as well as bruising. Depending on the amount of blood loss, patients may exhibit signs of shock, such as rapid heartbeat, rapid breathing, dizziness, and pale skin. In severe cases, a large hematoma, or collection of blood, may form in the flank area, which can be felt upon physical examination. Diagnosing a renal rupture typically involves a combination of physical examination and imaging studies. A thorough physical exam helps assess the patient's overall condition and identify areas of tenderness or bruising. Imaging studies are crucial for confirming the diagnosis and determining the extent of the injury. A CT scan with intravenous contrast is the gold standard for evaluating renal trauma. It provides detailed images of the kidneys and surrounding structures, allowing doctors to visualize the rupture, assess the degree of bleeding, and identify any associated injuries. Ultrasound may be used in some cases, particularly in children or pregnant women, to minimize radiation exposure, though it may be less sensitive than CT. Urinalysis is also performed to detect blood in the urine. Renal ruptures are typically classified based on the severity of the injury, which helps guide treatment decisions. The American Association for the Surgery of Trauma, or AST, has developed a grading system. Grade I injuries are minor contusions or hematomas without any laceration. Grade I injuries involve superficial lacerations less than 1 cm deep. Grade CI injuries are lacerations greater than 1 cm deep without urinary extravasation, meaning urine is not leaking outside of the kidney. Grade IV injuries involve lacerations extending into the renal collecting system with urinary extravasation, or segmental infarct. Grade V injuries involve a shattered kidney or avulsion of the renal hilum, the area where the blood vessels and ureter enter the kidney. The treatment and management of renal rupture depend largely on the grade of the injury and the patient's overall condition. Minor grade I and II injuries can often be managed conservatively with bed rest, pain medication, and close monitoring. In these cases, the body may be able to heal the injury on its own. However, more severe grade II IV and V injuries often require surgical intervention. Surgery may involve repairing the laceration, removing damaged tissue, or, in the most severe cases, removing the entire kidney, a procedure called nephrectomy. In addition to surgery, blood transfusions may be necessary to replace lost blood. Angioembolization, a minimally invasive procedure that uses catheters to block off bleeding blood vessels, can be used to control bleeding in certain cases. Strict bed rest and monitoring of vital signs and urine output are crucial during the recovery period. While it's impossible to prevent all traumatic injuries, there are steps you can take to reduce your risk of renal rupture. Practicing safe driving habits, such as wearing a seatbelt and avoiding distracted driving, can help prevent car accidents. Taking precautions to avoid falls, especially at work or at home, is also important. When participating in contact sports, wearing appropriate protective gear can help cushion the kidneys from direct blows. For individuals with underlying kidney conditions, working with a doctor to manage their condition can help strengthen the kidneys and make them less susceptible to rupture. The prognosis for renal rupture varies depending on the severity of the injury and the patient's overall health. Most patients with minor grade I and SI injuries make a full recovery with conservative management. However, more severe grade SI, IV, and V injuries can have significant long-term consequences, including chronic kidney disease or the need for dialysis. Recent research has focused on developing new and improved methods for managing renal trauma, such as the use of minimally invasive surgical techniques and advanced imaging technologies. Angiembolization has become increasingly utilized. Furthermore, research continues to explore strategies for preventing traumatic injuries in the first place.